Well, good morning, everyone, and welcome to this cold winter day here in my part of the world at Bronie's desk. Today, we have my dear friend, Dr. Lisa Singletary, who once again has stepped in at the last minute because my other guest didn't confirm in enough time for me to realize that they would still be coming on. But that's okay. That's Dr. Lisa is she's just a very supportive friend, and she has a wealth of knowledge. So I am glad to have her at any time. So without any further ado, because now I know Dr. Lisa has things on after, but I'm doing a winter wellness this month. And part of that, is keeping well is joint pain, which in the winter seems to hit people more than not. So I asked Dr. Lisa if she would share a bit of knowledge on joint pain, bones, and because our aches and pains we get during winter. So with no further ado, Dr. Lisa, I'm handing it over to you today.
Thank you, Bronwyn. It is a privilege to be here with you. Thank you for having me. And I'm so glad I could step in for you. I did recently do a talk on bones. I think I called it The Secret Life of Bones. And I talked a lot about bones and bone marrow. And someone asked me a question at some point about joints. And then you asked me something about joints, and I said, well, I talked about bones, and you were like, well, that's joints, isn't it? So I literally 8 minutes before this show started, I threw together a little presentation called The Difference Between Bones and Joints. So I'll share that with you.
Very good.
And
so we've had you floating around all over the place beforehand, and you can't find it.
Well, I might pull up my my bone slides because I do want to. I do like showing the anatomical pictures of bones, but
yeah.
No, I don't want to share it. I want to present. There we go. But Canva wrote this presentation for me. So this is a test to see how Canva's doing with their anatomy and physiology. So let's see. Join us to explore the differences between bones and joints and discover how to support them naturally. That's exactly what I asked Canva to show. Oh, that's fancy. So we're going to explore key topics related to bones and joints and their natural support. What are bones and their functions? What are joints and their roles? The key differences between bones and joints, common issues affecting bones and joints, and natural ways to support them. Let me get this out of the way. So one thing about bones, there are 6 kinds of bones, 6 types of bones in the body, which I remember being surprised to find that out. So your skull bones, your rib bones are very different than your arm bones and your leg bones. And they grow differently and they function differently in your body. So let's see what it says here. The vital role of bones in supporting your body's framework. Yeah, but bones are much more than just framework. They are essential for structural support. That's the framework part, protecting vital organs in your body. But here we go. They also play a critical role in mineral storage. Yes. And blood cell production. which makes them integral to your immune system and your overall health and well-being. I love it. Good job, Canva. So, understanding joint basics. So, joints are essential connective structures that allow for flexibility and movement within the skeletal system. They cover the bones, they're the ends of the bones. So, when you see them in on a chicken bone, that's the gristle. The gristle forms, or the gristle is made up of cartilage that covers the ends, and they're supposed to decrease friction. But the number one thing that decreases the friction is the fluid within that space. And it's very, very important. Let me see what this says. Joints are essential connective structures that allow for flexibility and movement. That's for the long bones, right? The joints let us walk. They give us hand movement. They support overall mobility. Yes. But the question I got the other day was, why do people get arthritis? So when you hear the word arthritis, and we don't talk about diagnosing, preventing, healing diseases, but I just want to define that word, arthritis. The ARTH part, ARTHR part, is directly indicating joints. And the itis part means inflammation. So arthritis is inflammation of the joint. So why do joints get inflamed? I'm going to answer that, but I want to see what are some more of these slides. Because they're doing a good job. All right. How bones and joint function are central. We do have 206 bones in adults. Bones provide structure and support while joints connect them, allowing for movement and flexibility. Okay, so the bones provide the structure, the joints let them move. Imagine, just look at your hand. Imagine if your hand didn't have joints, right? It just had those bones. And you would have to do everything flat hand. Yeah.
Like Mr. Scissorhands.
There you go. Exactly. So the bones, support and protection for sure. But I have to highlight the bone marrow. That's where the blood cells, the red blood cells and the white blood cells get made in the bone marrow. That is an amazing, amazing structure. But your bones are amazing anyway. So, but they do provide framework. They do provide protection. And with the bones and the joints, they're levers. So they help you move a lot of weight with a very lightweight structure. It's amazing. So your joints enable smooth movement between the bones, and that's what we want. We want that cartilage to be smooth. When we want the joint space to have some fluid in there that also decreases the friction so that movement is smooth. So what are some common bone issues? Well, osteoporosis. Now you'll hear another word besides osteoporosis. There's something called osteopenia. So osteopenia is the general thinning of the bones, but osteoporosis is when it gets to a significant stage where you're really prone to or at risk of fractures. Now, there we go, arthritis. Joint health issues. The number one issue of joints is arthritis. And millions of people are afflicted with this. And yes, chronic pain impacting daily activities, impacting quality of life. It is one of the number one, or one of the main debilitating issues in adults. And you know what? More and more kids are getting it too.
Yeah, I know some that are born with it.
Yep. So, natural ways to support bone health. I'm going to show you. I'm going to show you on another slide more specifically what are some natural ways to support bone health. But we have vitamins, minerals that we think of. Particularly, we think of calcium, vitamin D. There are others. We think of nutrients, the leafy greens, dairy products, got milk. But this is very important. Weight-bearing exercises. Now, there are different reasons to exercise, and different types of exercise have different effects on the body. But the bones, the cells of the bones respond to weight-bearing exercises. Now, does that mean you have to go to a gym and have the barbell? No, you can do it at home. You can use your body weight. You can use a baby, lifting the baby.
Yeah,
You can,
I got one of them.
yeah, you can fill water bottles and, use the water bottles as weight. You can, but the key is that you challenge your bones with weight-bearing exercises, and that makes them stronger. Okay, here's a good point. Adequate hydration. So, and I think I'll talk about that the joint problem, because number one, a lot of people don't get enough hydration. And that means we're not exchanging that joint fluid enough. We don't make enough of the joint fluid, and we're not circulating it enough. Why is this important? Well, your bones are very, very vascular. I mean, they make blood, but not only do they make blood, they have a great deal of blood supply, which you'd find out if you have different types of fractures. That's the bleeding after a fracture, especially one that's broken through the periosteum, which is a covering of the bone. Bleeding is a huge risk until it starts to clot, But the cartilage on your joints, that smooth, and you got cartilage in your ear too, you have cartilage in many places in your body. But that smooth cartilage, there are cells that live in that cartilage, and there are cells that live in the bone, and that's how your bones continue to remodel. That's how your bones can heal after a fracture, because there are cells there that are doing this whole cycle of chewing the bone fragments and laying down new bone. We call those osteoclasts that chew, and osteoblasts that build. And they have this dance with all of the natural things that we provide, and they keep your bones healthy. And they repair your bones when they break. So that blood supply and those cells that are living in the bone tissue are very, very important. And you have cells living in the cartilage. They're called chondrocytes. there's not going to be a quiz. You don't have to, you
Oh,
don't have
that's
to
good.
remember that. But here's the point. Here's the key. Your cartilage does not have a blood supply. So those chondrocytes that are sitting in the cartilage, they have to do all of their metabolism. They have to get all of their nourishment, and they have to release all of their weight into the joint fluid just by osmosis. So if you're not getting enough hydration, you're not producing enough joint fluid, you're not moving that joint fluid, because they say motion is lotion. When you move your joints, you're moving joint fluid around. And when you don't do that, it gets stagnant, it gets toxic, it gets sluggish, and your joint cells can't keep up with all of the maintenance they have to do on the cartilage. So that's one reason. And trust me, they didn't teach me that in medical school. But the essential role that hydration plays. So a lot of times you might find that if you have a little extra joint pain one day, drinking more water will help to relieve that a little bit. So let's see, natural ways to support. So those were the natural ways to support bones, natural ways to support joints. Well, I'm going to say number one, hydration, right? For this, just that whole discussion we just had. Regular exercise, yes. Low impact exercises, yes. Supplements, glucosamine, and I'll talk about some more. Usually you hear chondroitin and glucosamine at the same time. And why is chondroitin? Well, that is a form of cartilage. So anti-inflammatory, or now what's in the news now? Hyaluronic acid is in the news. And it is an important an important precursor to the structures that we need, the collagen that forms our connective tissue. So all of these things. Anti-inflammatory foods, love it. They can support joint function, minimize discomfort, but we want to not be in the joint pain in the first place. So hopefully, with all of these lifestyle changes, and particularly in longevity, the supplements that we know, love, enjoy, we can support and nourish both our bones and our joints. Was that clear, Bronie?
Yeah, that was excellent.
Okay, so how do we, in longevity particularly, support bones and joints? Let's see, is this a presentation? Yes. Well, I have, number one, created this 5 steps for joint support. Actually, there's 5 steps for nutritional completeness. So we want to nourish our bodies deeply. The cells of our bodies, the cells of our gut microbiome, and the cells of our bones, and the cells of our joints. I'm talking about the chondrocytes. I don't know why I keep saying chondrocytes. I like it.
It's your word of the day.
It's the word of the day. So, what are the 5 steps? Number 1, avoid the bad foods. Why? When you are taking in these bad foods, gluten, seed oils, you know the foods. I call it, it's like taking fire on a fork. And you're putting these inflammatory, because phlegm, the inflammatory part, phlegm means flame, right?
Yeah.
So you're putting fire right into your body and then telling your body to deal with it, often without proper support. So you're setting up a vicious cycle. So avoid the bad foods. Step number 2, you need 90 essential nutrients. The word essential means your body needs them, but medically, biologically, biochemically, the word essential in the body means your body can't make them. So you have to get these supplements, or you have to get these nutrients in somehow. We used to be pretty good with food from here or there. I say that because all of the nutrients aren't even in the crust of the earth. But these days, the earth, the soil is so diminished, we have to supplement it.
True.
Step 3, the 3 A's: antioxidants, adaptogens, anti-inflammatories. Why? Well, our bodies are designed to handle stress for a really short period of time, right? Just so you can run away from the bear or, have superhuman strength to lift up the car or whatever. But we're not supposed to be under chronic stress, number 1. We're not supposed to be living in a toxic soup of the environment, whether it's pollution or electromagnetic overwhelm or just the stress of what we get in the airwaves from TV news, from social media. Our bodies need help. So even though we make antioxidants naturally, we don't make enough to deal with life in 2025. So we need to support the body with antioxidants, adaptogens, and anti-inflammatories. Step 4, you've heard it said, you are what you eat. Not true. You are what you absorb. And in order for you to absorb whatever you're giving yourself, whatever little bit of nutrients might be in the food or the supplements that you take, in order for them to absorb into your body, your gut has to be healthy. And that means the gut lining, that means the gut organs, your pancreas putting in digestive enzymes, your liver putting in bile, and particularly your gut microbiome. And then step 5, I call it wellness wonderland. That's everything else. When you hear about cryotherapy, red light, infrared therapy, I just got a chill thinking about cryotherapy. You guys don't have to have, you guys have cryotherapy right now. It's getting cold, right?
It's a bit cold.
But targeted support, like joint support, brain support. When people say, oh yeah, I take chromium and vanadium, or I take cinnamon for my blood sugar, and that's all they take, that is, that's part of step 5. So yeah, feel free, go for it. Try all those things. Try the patches. Try the magnets. Try the art therapy. So many things, but you're not going to get the most benefit out of them unless you build it on the first 4 steps. That is the foundation. But what about this joint health? How can we support our joints? Well, I looked at the science and I made a list of the top researched natural ingredients for joint support. And some of these things, well, most of these things should look familiar. Glucosamine, chondroitin, omega-3 fatty acids, turmeric, curcumin, which is part of turmeric, collagen, boswellia, MSM, green tea extract, vitamin D, magnesium, SAM-E, borage oil. They've all been featured in scientific studies and shown to have a beneficial effect on joint health. So where do we find these things? So I made this little comparison. So we know beyond osteo, whether it's powder or liquid, is part of the Healthy Body Start Pack. And so I put the ingredients of each along with their little thumbnail, or what do you call it? Their cart image.
Yeah.
So let's look. This is good stuff, right? 1,200 milligrams of calcium, 300 milligrams magnesium, MSM, trace minerals, a little bit, 140 milligrams, glucosamine, great stuff. And very, very similar ingredients, but just a little different profile. But again, 1,200 milligrams of calcium, 300 milligrams magnesium. Love it, love it, love it. What else? Ultimate Osteo FX. Again, little different profile, but we've got calcium, magnesium, vitamin D3, glucosamine, boron, MSM. Sounds familiar? Now,
Yeah.
whoop, whoop, hats off to the Pro line. Oh my goodness. This Pro Joint FX, the ingredients are amazing. The joint rebuild with the glucosamine, MSM, collagen, hyaluronic acid, joint relief with turmeric, olive leaf, hops, boswellia, and trace minerals. This is an amazing, amazing group of ingredients right here. The amounts, however, are different. So, and that's the trade-off. But your body can do a lot with a little bit, especially when the ingredients are so absorbable. So, now I didn't mention, but K2 as well as the vitamin D. So just an amazing product, the Pro line. Now also, I always have to look up the difference between liquid glucogel and glucogel plus. And the glucogel plus has a lot of glucosamine, like 2,000 milligrams of glucosamine, plus this antioxidant blend. The liquid glucogel, amazing, has glucosamine, but not as much, right? 750 milligrams compared to 2,000 milligrams. Chondroitin, 200 milligrams compared to 1,200 milligrams. But the liquid glucogel has CMO, cetyl myristoyate, as Tom Chenault would teach us how to pronounce it, as well as collagen. So both amazing, right? But they both have their profiles of ingredients. Ultimate Oxsteel Mag, so sometimes we need a little more magnesium. That has 200 milligrams. The Ultimate King Calcium. Now this one, I haven't had King Calcium, but I think it's a chewable tablet. There it is. It says there. So I probably would be addicted to these. It looks like they taste really good. So I haven't tried them, but they look amazing. Vitamin D, vitamin K, calcium, magnesium, not too much magnesium. Look at that. Zinc, selenium, boron. We just have amazing products. I just have to say. Ultimate Glucogel. Okay, hands down, hats off to the Glucogel, because this was like the original collagen product that we have, because gelatin is collagen that's basically cooked. So, um, and your body knows what to do with it, right? Your body treats it the same. So 500 milligrams of collagen or gelatin plus 500 milligrams of glucosamine. Whoop, whoop. But we've got other ways to get collagen now. We've got our collagen peptide joint health. So, again, amazing, amazing products. Here's the other reason I don't take the Choose, the King Calcium, or anything like that, because this is my personal favorite joint product, and that is Bone Building Formula. And that has 300 milligrams of plant-derived minerals. Amazing. Plus,
it's one of my husband's favorites.
Oh, cool. Glucosamine, horsetail, rose hips, magnesium, calcium. You know, I love it. The only drawback to this product is one dose is 5 capsules. I take 2 doses. I take 5 in the morning, 5 at night, and I love it. But some people are like, no, I can't take that many capsules. Okay, so they have options. All right, now we've also got the Stay Natural line. We got the herbal. So, most of longevity products are mineral based, but we've got some great herbal based products. Thank you, Dr. Laura Dennison. And this has shark, cartilage, white willow, collagen, MSM. I mean, it's just another way of supporting and nourishing the bones and the joints. We've got our Biomedics line. So there you go with the Flexicare Plus, which is this stuff, this biocellular micellized formulation. We've been so far ahead of the pack. Now everyone's getting into nanotechnology and mycelials and really realizing that you can't like shave a nail and put it on your cereal and expect your kids to get iron, because your body's not going to absorb it. So they're figuring out how to chelate things, how to micelize things so that the body can absorb them. But the Biomedics was way ahead of the pack with that. OsteoProCare with our new line. What's the Life Force, right?
That's it.
Another great product. Calcium, magnesium, zinc, selenium, 100 milligrams. Awesome. Chromium, vanadium. So good not only for joint support, but also blood sugar support. So, and I love that. I love how many of our products are, here's pharmacist Ben's word, multifunctional, multifactorial.
Yes.
Oh, there we go. So this is this is my invitation to you for Saturdays at 11 a.m. Eastern. I do a weekly live Zoom called Total Transformation Secrets. And I have a gift for you. I gotta find it though. I wasn't I was not. It's at the end of the other slide presentation with the bones. So let me find it. I just need to get out of this presentation. And let's see.
So that's about 1 o'clock in the morning for us, Sunday morning. You're 11 a.m. I was just working it out.
Bones, bones, bones. Where are the bones? Oh, there it is. Okay. Oh, I love this. I have to share though. Okay. So I'm going to skip through these because I want to get to the gift. But I'll just say a couple of points, like your bones, your skeletal system comprises 20% of your body. So between your between your bones and your muscles, that's over 60% of your body weight. How bones grow? Well, it depends on what kind of bones. So there are 6 types of bones and they grow differently. But the long bones are the ones that, the kids, they can bump and they can fall and they don't break. That's because their bones are mostly cartilage. But then as they grow, they become calcified. But look at that. Bones are so amazing. This is a microscopic, tiny, tiny picture of the cells that live inside the bone. So I call it the bone condominium. The cells make this structure around them and they just kind of seal themselves in. But the bone cells, they've got it made. The cartilage cells, man, they're fighting. So, but see, these cells mature and they live in these little apartments inside the bone and the cartilage. So we've talked about that. How bones heal. Oh, bones are amazing. That'll be another talk though. But remember I said the bleeding. Well, your bones have a covering called a periosteum. And if you have a fracture, but the periosteum is still intact, that's like an internal Band-Aid and it compresses it and it stops you from having too much blood loss there. But if that periosteum is broken, then not only blood loss, but different type like hematomas, emboluses, bone fragments, all kinds of problems can ensue. So we don't want any fractures to happen. So in the ends of your long bones, you've got bone marrow, and that makes blood, and your blood carries oxygen. Your red blood cells and your white blood cells fight infections. Look at that. Bones are amazing, but look at this. No blood in the cartilage.
Yeah.
Right?
Looks like an iceberg.
Huh?
Looks like an iceberg. See, all the work's underneath.
Oh, this is important. You don't want to be hospitalized because when you get in the hospital, when you're on bed rest, you lose muscle. And so the muscles decrease. Losing the muscle means you don't have as much tension on the bones and your bones thin and your bones get sluggish and your immune system drops at the very time you can't afford it. So be kind to your bones. You got to support them with vitamins, minerals, antioxidants, and collagen. So we talked about the 5 steps. Dun, 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 dun. There it is. So that PowerPoint that I showed you with the products side by side and, you know, the comparison of the products. If you scan this, you can get it. Or if you go to drlisasingletary.online/5 steps for joint support. But put hyphens in there. So it's 5 steps for joint support.
Just wait a minute. I'm trying to get my scanny thingy up.
Oh, okay.
There you go. Look at that. See?
Ta-da.
Because sometimes you can't find the app when you want it.
Yeah.
There you go. It's coming.
Whew. Okay.
Thank you very much for that. That was very interesting. And the interesting thing about this was, Dr. Lisa, now if Grant doesn't ask you a question, I will be very surprised, because we actually were talking about osteoporosis and that other word before
Osteopenia.
you popped on. So am I right, Grant?
Absolutely, yeah. My big question is, if you've got a gut issue like leaky gut, that really buggers up the works as far as repairing particularly cartilage and things like that. Is that right?
It buggers up everything.
Yeah. So and the leaky gut, you really have to be very, very particular about what goes in the mouth and what doesn't go in the mouth. Yeah.
Well, yes. So your metabolism starts in the mouth. You got to chew your food.
Yeah.
Thoroughly. Because when you don't chew it, and of course, you know, we're into swallowing food down just as quickly as we can. But chewing the food is very important, because the stomach, there are no teeth in your stomach. There's acid in your stomach. But your stomach just massages food and mixes the acid. So you need to use the teeth in your mouth to get the particles small enough so that the stomach acid then is strong enough to break down the food particles that you swallow down. Because if they're not broken down small enough, then when it gets into the intestines, those particles are just going to try to punch through. And there you go, leaky gut. So here's the problem. Your body, your immune system is designed to determine what is Grant and what is not Grant. And if something is not Grant, then it's supposed to attack it. Well, when you have these larger particles enter into the bloodstream from a leaky gut, those particles mimic some of Grant's tissues, like, because your proteins, your enzymes, and all, they fit like hands and gloves. And when there's something that's not supposed to be there, and your immune system gets triggered, and it says, alert, alert, there's something that's not Grant here. We got to take care of it. And your immune system goes into action trying to take care of that foreign invader. But if it looks a little bit like Grant, and it can kind of fit into some of Grant's, tissues, then the immune system is like, oh, this looks like that. It must not belong. Let's go into action there. And it's a setup for autoimmune disorders.
Yeah.
I hope that made sense. It made sense to me.
It sort of does. Yeah, the body gets confused as to what's body and what's not body. And the other thing is, how long does it take cartilage to regrow when you do everything right?
It depends on the person. Still,
well, let's say hip cartilage for a fit bloke, otherwise fit bloke.
Yeah, I have heard, and I would be uncomfortable saying it would take less than a period of months. Now, I have heard shorter periods of time, but I would say at least 6 months, with everything being done correctly.
Yeah.
I would think that it would also depend on the damage that is done to
Sure.
each
And that,
particular
you know,
person,
I'm
individual.
just saying that's to me, that would be the minimum.
Yeah.
Yeah,
I'm agreeing with
for
you,
me,
Doctor. I'm not
for me
arguing.
also.
So what would you
For me
then
also,
say
it's
to
the
someone
amount
who
people take.
Yeah. Many factors. Yes.
Yeah.
Mm.
Having a therapeutic dosing is so important for your health challenge. You know, whenever you listen to doc stuff, it's more, and certainly with my patients as well. You know,
Yeah.
the ones that can afford it are the ones that do take, you know, their therapeutic dose, you know, 3 times their maintenance dose. They see a lot faster recovery, especially in the bone and joint area. It's just an easy one. I don't mind patients coming to me with arthritis because it is one of the easiest ones to turn around. It's their mindset, which is the hardest.
Yeah.
That's
Well,
very
when
true.
I started my longevity journey, I only knew about BTT, but I had heard it was dose per body weight. So I took 7 scoops a day, and it changed me. In 8 months, I lost 85 pounds, got out of a wheelchair. But when I shared that story, when I got my some plaque, what is it? Rising Star. When I got my Rising Star award, man, when I shared that, the chat people started saying, "That's too much. You can't take that much." Hey, it made the difference for me having that amount of nutrition in my body. So
Yeah.
and
You
my
got to be
body
able
let
to
me
absorb it,
know.
eh?
Say that again.
And it's important that you can absorb it. And part of the Healthy Start Pack program, of course, from day one with the BTT, is there's a digestion support in there. And so taking those big doses, not probably straight away, you know, go little steps to get started. You know, it's like warming your car up in the morning. You just don't go from, you know, from 0 to full and go. You warm it up. But once you get going, get that therapeutic dosing, get off the bad foods, you know, the story you just talked about, you know, just you know, that's a very easy story. It's even a cheap story for everybody because we can all afford to stop eating, you know?
That's
Yeah,
that's
But
that's
yes,
true.
mm,
Sorry.
anyway, love your talk. I do have to go. So thank you so much for coming on again. And yeah, more about bones. I think it's a great topic, and people want to know how their bones heal. And some of your explanations have been awesome. Thank you.
You're
Oh,
very welcome.
that's awesome. It definitely has been, Dr. Lisa. I was going to ask you, and I'm not sure if we're just about out of time. What do you say to someone who has been told they've got nothing in between the joint at all? You know, all the ligaments and tendons and fluid or whatever has just
Bone on bone.
yes, bone on bone.
Yeah.
So how would you go about telling them showing them how to regrow it
Well,
without having
again,
to have a knee replacement or a hip replacement?
yep. I understand exactly what you're saying. And you know, we've got the stuff because we talked about Z radical and fucoid Z before. We have things that stimulate stem cells. The stem cells are things that build and rebuild the body. But you have to give a lot of support for that. It takes a lot. So when people can't fully support or they don't want to, or, you know, whatever, they make the decision to get surgery. Well, in that case, I'm like, well, prepare your body for the surgery, right?
Yeah.
Even if you're not taking enough to regenerate your cartilage, take enough so that your immune system is in full force so that you can heal.
Yeah, exactly. And of course, getting rid of the bad foods is first step. And Harry, I'm guessing you had a question, mate.
Yeah, I just want to ask Dr. Lisa, can you regrow the discs? I believe that you can. from my experience anyway, but it's one of the things you said.
Yeah, but same thing. You need extra support for that.
Yeah.
And time.
Absolutely. Well, time's the biggest thing, the biggest factor to add to it too, and having patience.
Yeah.
Yeah.
Yeah, we don't do the fixes as quickly as the Mr. Bard and Mr. Parker. That's the name of the guys that make the scalpels. Bard, Parker. So our technique is natural. We work with the body, but that takes time and that takes patience.
Because I believe if you say have a hip joint or any joint replacement, it only lasts 10 years and you've got to go and have it all again. I mean, why would you do that? And then,
you know, it's a mixed bag. There are people that have wonderful results from joint surgery. I have to admit it. There are a lot of people that have complications and that have trouble. And look, if they're not changing their diets and if they're not getting support, then how are their bones going to absorb or, assimilate these foreign substances, these structures, these joints? So
yeah, that's true. There's some people, actually a lot of people are not prepared to, they just want the quick fix. So they
most people.
Yeah, we don't want to change our lifestyle. We don't want to change what we eat. We'll just go and have the surgery.
Which is why my last talk on Saturday was why the brain gives us such a hard time with change. That was my whole thing. All right. Well,
I better let you go because you've got something else to be on. And so as I ask you all nicely here in Bronie's world, just stay safe, stay informed, be empowered, but do not live in fear, my friends. And when you're giving your bones and your joints what they need and taking the 5 steps that Dr. Lisa just shared with us, then you too will be powerful, beautiful, brilliant, and most definitely very brave. God bless you all. And I'll catch you again tomorrow here in Bronie's world. And thank you, Dr. Lisa, for coming and stepping in for us today. Bye, everyone. God bless.
Thank you, Dr. Lisa. Thank you, Bronnie.
You're welcome.
Yeah.